Good afternoon to all, but also good morning and good evening to many of us. It's our pleasure to welcome you to the ITM Alumni webinar organized in light of the International Day of Women and Girls in Science, which was celebrated this Saturday. In this webinar, ITM PhD alumna Dionicia Gamboa Vilela will talk about her career paths in research, science, and academics. The main aim of the ITM alumni webinars is to share research findings, expertise, and experiences in the field of international public health and tropical medicine within the ITM community of alumni, students, staff, partner institutions, and the wider global health community. I will now briefly explain some of the practicalities of this webinar. If you want to ask a question, you can use the Q&A option you will have below your screen. If you want to ask your question in live, you can raise your hands below your screen as well, and we will unmute you. The chat is being disabled for questions. Questions will be moderated and only a select number of questions can be answered in live given the limited time. Unanswered questions cannot be answered individually afterwards, for which we apologize. At the end of this webinar, a short survey will be displayed and a browser window will open to give your feedback. The webinar is being recorded and will be made available afterwards on the ITM Alumni platform. I will now give the floor to our today's moderator, Antene Asefa. Dr. Antene is a health system researcher with more than 13 years of expertise on global health issues, including maternal, sexual, and reproductive health, HIV/AIDS, and tuberculosis. He completed his PhD at the Nussel Institute for Global Health at the University of Melbourne in Australia, investigating health systems constraints to the promotion of respectful maternity care in Ethiopian hospitals and mitigation approaches using the complex adaptive systems theoretical framework. Currently, he is a principal investigator of a mixed methods longitudinal study in Ethiopia and Guinea, which examines the link between the mistreatment of women during childbirth in health facilities and postpartum depression and health system capacity to improve respectful maternity care and maternal health services. Antene, the floor is yours.
Thanks, Charlotte, for your kind and nice introduction. And good morning, good afternoon, and good evening, everyone. Warm greetings from sunny Antwerp. Celebrating the International Day of Women and Girls in Science, this ITM webinar puts in the spotlight Professor Dionicia Gamboa Vilela's career path in research, science, and the academia. Professor Dionicia is an ITM alumni who is a biologist with a PhD in biomedical sciences earned from our Institute of Tropical Medicine in Antwerp, Belgium, and the University of Maastricht in the Netherlands. Professor Dionicia currently works as a full professor at the Faculty of Science and Philosophy at Universidad Peruana Cayetano Heredia. She is also director of the malaria laboratory belonging to both units of FASI, which means Faculty of Science and Philosophy of the University, and the Institute of Tropical Medicine Alexander van Humboldt at the University. Both institutes are ITM's long-standing partner. The collaboration started in 1998 and is still ongoing under Framework Agreement 5. Professor Dionicia was also awarded with a number of prizes for women in science, both at international and regional levels. In this webinar, Professor Dionicia will talk about her study and career trajectory in research, science, and academics, while also shedding some light on the current situation of women in science in Peru. Professor Dionicia will also talk about the important role of mentors and institutional support in a scientific career. Her personal experience and presentation will serve as the starting point for an exchange and a discussion on the challenges she has been facing as a woman in science along the way. I will now give the floor to Professor Dionicia. The floor is yours, Professor.
Thank you very much. I will share my screen. Okay. Good morning, good afternoon and good evening. First of all, I would like to thank the organizer for the invitation to share with you part of my trajectory as a woman in science, Peruvian woman in science working in Peru. For me, really it's an honor to receive this invitation and to share with all you. First of all, I'm going to talk a little bit about myself. So in that way, you will know me better for those that doesn't know me. I'm a biologist. I did my bachelor at the Universidad Peruana Cayetano Heredia. I will call later on as a UPCH, it will be easy. Then I did a master in science in biochemistry, also at the university. And later on, I applied for a PhD scholarship to do the PhD at ITM in collaboration with the University of Maastricht in the Netherlands. This was awarded in 2008, the degree. And what I'm doing is I do a little bit of teaching. I have courses on undergraduate and postgraduate level. I'm also mentoring students. Here in one of the pictures, you can see two of my mentees that now are independent researchers. And also I'm working in malaria. This is my research field work nowadays. I'm working in the Peruvian Amazon region in Loreto, specifically in Iquitos and the communities around Iquitos, doing some basic and applied research in this area, working with a very hardworking and nice team in Lima and Iquitos, together also with the Direza Loreto and the Minister of Health. In summary, so my activities are teaching, mentoring, doing research, and of course having fun, because if you are not having fun and not happy with what you're doing, it's better to choose for another career. So how do I get here? I always describe this as a combination of circumstance, opportunities, and decisions. So you will know a little bit more about that. The circumstance in the 90s, for example, when I finished the school and I wanted to pursue a university career in the area of medicine first, and then I changed for biology, it was because in the 90s it was difficult to study in a university in Chiclayo, my hometown. So I had to move to Lima, a big and crowded city, the capital of Peru. But it was the best option for me because the best university, Cayetano Heredia, is in Lima, and in the area of biomedical careers. It was hard work to get there, and of course to stay there, because it was not only to study and to get to be admitted at university, but also to remain at university with all the courses that sometimes were a little bit difficult. So then I got the bachelor degree in biology. And at that moment, when I finished the career, I had to look for what to do. No, so looking for a job to related to research, because I like to be in the lab doing some projects and or doing a postgrad student. So at that moment, again, to migrate was the best option. So I was looking to do a PhD outside in the United States was my first option at that moment. But then an opportunity arose. So the university was promoted the master in biochemistry, and they were giving scholarships for the students that were admitted. So I decided to apply for this program. And of course, one of the how to pay for the scholarship, we will say like that, was to work as a teaching assistant. So we were helping the professor with the courses. At the same time, I was working in the lab and doing my thesis, and also helping the other students that were under doing the biology courses. So it was a full-time dedication at that moment. So later on, I got a master's degree. And once again, I had to make a decision, looking for a job again to continue research or doing a PhD abroad, because that's what my main objective at that moment, to get a PhD to continue in research. So when I was preparing myself to do the exam, the TOEFL and GRE, so one opportunity arose at that moment. So as it was mentioned already, the Institute von Humboldt has a long-standing collaboration with the Institute of Tropical Medicine in Antwerp. So they were having these scholarships for PhD to do a kind of sandwich system at the Institute of Tropical Medicine in Antwerp, and or in this at that moment was in collaboration with the University of Maastricht. So I applied, I got the interview, I had the interview and got the position. And of course, another group of challenges arise. It was other countries. I have to move between Peru, Belgium, and the Netherlands to meet new people, other customs, other language, and climate, food. So it was a very challenging, but I liked it because I was doing what I wanted to do. So then when I got the PhD degree, so once again, I had to take a decision to stay, to go somewhere else, or to return to Peru. My friends that did the PhD also abroad faced the same decision. Most of them returned to Peru, but unfortunately they couldn't stay, so they went back to United States or Europe for a postdoc or to continue the career, because at that moment it was difficult to establish their own research in Peru. So once again, an opportunity appears. It was a re-entry grant funded by the Belgian Corporation. So they was funding, they know that if they invest in the PhDs to cut this gap between the senior and younger researchers, they need to secure that these young researchers will continue doing research in their own countries and not go abroad. So I got this re-entry grant and from 2008 and 2011, so as a postdoc coordinating the project between the Institute in Antwerp and the Institute of von Humboldt. This scholarship included a stipend for the 3 years, operational expenses for the lab implementation, seed money for a pilot project. Why I mention this? Because when you receive a re-entry grant and try to become an independent researcher, it's difficult if you don't have this institutional support, but also the money to start building up your own group. So if you receive just an empty lab, you don't have money for equipment to do some preliminary experiments, because most of the funding agencies request preliminary data in order to give you support for a new project. So in my case, thanks to this re-entry grant, I have this operational cost to buy small equipment and to do some basic experiments to get data to apply for these projects. In addition to that, it was very important institutional commitment, because the Belgian Corporation gave me this scholarship, this re-entry grant, but if the university didn't support me at that time, maybe it was not possible. So at that moment, my mentor, Jorge Arevalo, and the Dean of the Faculty of Science at that moment, together with the Institute of von Humboldt, they support to give me a contract as a professor, and also in space. You see in the top of the lab that I got at the Faculty of Science, of course, empty lab, was only 2 tables. But with the operational expenses, I could implement the lab, as you can see in the other picture. And of course, in addition to the contract and the space, I started teaching and be in contact more with the students. So in that way, I could start building this group of research. In addition to re-entry grant, the institutional support, of course, the role of mentors was very important. So I had 3 mentors, Jorge Arevalo at the Universidad Peruana Cayetano Heredia, Jean-Claude Dujardin at the Institute of Tropical Medicine in Antwerp, and Guillaume Baneves at the University of Maastricht. So we had a very fluent, open, and transparent communication. I had access to their networks and opportunities. They always push me to apply to different projects. They say, if you don't apply, you never know if you will receive or not the fund. Also enthusiastic support, and they are very good advisors until now. And another challenge I have to face when I started my own group was to switch from Leishmania to malaria. I did my PhD with Jorge Arevalo and Jean-Claude in the area of Leishmania, working mainly in the lab, only, I didn't see patients, I didn't do field work. But when I had to switch malaria, because they told me, now that you finish your PhD, you need to look for your own niche. And I started this malaria research within the Belgian collaboration project. So I switched from the bench to the field, working with a multidisciplinary team, because before I was working only at the lab with biologists, but in malaria I have to work with technicians, with medical doctors, entomologists, and not only doing lab work, but also field work. And I met new mentors that until now I'm learning a lot from them, and also role models. No? So a lot of researchers that I meet on the way of this malaria research that are helping me also to build up my character and my career. And of course, a reliable team of collaborators and friends that are making possible all the achievement that we have or we go during all these years. So this is, in summary, as we can call the career paths. You see, the bachelor degree in biology at Cayetano Heredia, the PhD and the master of Cayetano Heredia, the PhD in biomedical science in Maastricht University in collaboration with the Institute of Tropical Medicine. I got the PhD in 2008. Then 3 years as a postdoc in Lima and Antwerp, working coordinating this collaboration program between these two institutions. And then in 2012, I got the position as an associate professor. And just this year in January, I got the promotion to be a full professor. So it looks very straightforward. It looks easy, but in fact, it was not easy, and it's still not. So, and maybe if there's some also researchers that are here with me today, you faces a lot of problems on the way, and sometimes are easy to solve, sometimes not. So you have to take decisions. You have to switch to change the path, but it is part of the learning process. So once again, a lot of circumstances, opportunities, and decisions. So it was not easy because as a re-entry grant, I got the tenure position as a partial time professor. It means only 25% of my time are covered by the university. So I covered this doing research and the under or postgraduate courses. So 70% of my time is devoted to research, but this research is basically based on the project that I got. So the 70% of my salary is due thanks to these projects. So in that way, I can live doing what I like the most, that is working in the lab. But in fact, it's not just that you are doing teaching only when you are in front of the students, in a class, because when we are doing research, we are also teaching. I mean, in my group, we have 3 master students. One is already going to defend the thesis. We have 3 PhD students, all of them from Cayetano Heredia University. One of the PhD students just finalized the thesis and she's writing the manuscript. I have 3 undergraduate students doing also the thesis in the laboratory within the projects. So we are teaching also the students in the lab, not in front of a class, but in the lab. And we need to recognize this also. So in 2020, the Vice Dean of the Faculty of Science asked me to be the chief of the Department of Molecular and Cellular Science. So it was a difficult decision to accept because I knew what was waiting for me if I accept this position, but okay, I took the challenge again. So I switched, I got this full appointment. So it means full-time contract by the university, coordinating this department that had almost 40 professors, 6 technicians and administrative personnel. It's the biggest department at the faculty, but I took the challenge and I devoted only 25% of my time during this time from August 2020 until February 2022, doing research, teaching, and 75% of my time in management, the whole department. And on top of this, it was during the COVID-19, so everything was by Zoom, so it was more complicated than in a normal circumstance. So in February 2022, I had to take another decision because the things were getting complicated in the fact that I was losing the contact with my students. I was not able to do most of the research that I was doing because most of the time was doing these administrative things. So I had to take another decision, and I talked with the vice dean of the faculty and resigned. It was not easy because I think I did a very good job at the department. We arranged a lot of things. We got new professors on the department. We reorganized some things, but I was losing the motivation because my main interest was doing research and be with the students in the lab or in the field. So then as I resigned, and again, starting in March 2022, I became again switched teaching only 25% and research 75%. And where I'm looking forward for the future, a new challenge. Now, this year, I accept again to coordinate the master program in biochemistry and molecular biology, and we'll see how it goes. So now moving to what we are doing in research, it was already mentioned, I'm working in malaria mainly. So this research is mainly in Iquitos, in Loreto, where malaria is concentrated. More than 80% of the cases of the country are there. So we have to not only just take samples and do the experiments, it's just more than that. So when we want to start a project, when we want to answer a question or validate hypothesis, first of all, after we write the project and we got the funds, we have to go to the communities where we want to do the project and to explain the project to the local authorities, to the community leaders, and the people from the community, because we are going to be there, we're going to go into the houses, take samples, take information. So first is the most important thing in this kind of work is the communication. Then after we got the approval from the leaders and the people from the community, we go house by house, taking sociodemographical data, taking the samples that are needed for the experiments, doing malaria diagnostic in situ, and also medical care. Part of our team are medical doctors and nurses, and if the community needs something else different from malaria, we try to help. I mean, we don't have the economical support to give all that we wanted to, but at least we gave basic care, or we transferred them to the nearest health facility in order to get the appropriate attention. Then after we got the information and the samples, we transfer the samples and the information to the laboratory we have in Iquitos, or to Lima if we need to do some more sophisticated experiments, or we send the samples of the information to our collaborators abroad. So in summary, what we are doing is providing scientific evidence that can be translated into effective public health intervention for malaria control and elimination. So we work very close with the DIRESA, the Regional Direction of Health in Loreto. We work very close with the Minister of Health. We had monthly meetings last year, and now we are going to start again the meetings next month, because all the information that we got, all the evidence that we get is for them. It's for them to improve the strategies, to take decisions, to write new guidelines, depending on the new context that we are facing. So it's what we are doing. No, it's not only to get information, to get publications, or to be in Congress. It's not only that. It's mainly for the communities. So now I will talk a little bit about women science in Peru, and I want to highlight the work that is been doing by the Peruvian National Council of Science, CONCITEC. They have this committee that is called Pro Mujer, Pro Women. You can see here the website and the link if you are interested. So they realized that it's very important to have more scientists in Peru, and also more women scientists in Peru, because unfortunately, if we see the numbers from the 6,853 researchers that are registered in Concitec, only 31.5% are women scientists in average in the different regions. And if, as you can see in the graph below, most of the women scientists are in Lima. So we need more scientists in Peru, more women scientists in Peru, but also more scientists in the regions. And there is a lot of potential. I know because I work in close collaboration with Universidad Nacional de la Amazonía Peruana and now with Universidad Toribio Rodríguez de Mendoza in Amazonas. There are a very important and capable group of women doing research, but the problem is few opportunities for them to do it or to be as noticed as we wanted. So that's why this committee is doing several activities in order to promote more participation of women in science. They have, for example, this scholarship Maria Reich that appears in 2022 just to support young researchers in Peru doing some mentoring work with other researchers in other regions. There is also this book that was published by Concitec trying to promote the scientists that are around the different regions and to promote science in schools, for example, because this book is free, you can download for free, and it's being used in the schools to promote the participation of women in science. And also there are some guidelines that they are developing, not only to promote more participation of women in projects in science, in engineering, in STEAM careers, but also a manual to promote the mentoring. As I mentioned before, for me it was very important the role of my mentors in my career, and now also the role models. So I work now with very great scientists, of course, with a lot more experience than me in different areas. And I'm learning a lot from them because that's the role models I see now. So we also need that scientists in Peru and in the regions have this kind of role models in order to see that you can do science, you can be good in science, and you can live, you can choose this as a career. Because before, when you said, I wanted to be a scientist, most people say, what are you going to do for living? In fact, I'm living only doing science. I'm not a rich person, but I'm happy with what I'm doing. So some challenges still that I face, and probably some of you also facing, the stereotypes, of course, a scarcity of female mentors and role models. As I mentioned, my role models, I have one role model at the university that was my first mentor when I was doing my undergraduate thesis, but then most of my role models are from abroad, unfortunately not from Peru. Cultural norms, unconscious and sometimes conscious bias, maybe some of you experience that. I have some experience of that, not only in Peru at my university, but also abroad. Lack of self-confidence. Sometimes women say, why I can do that? Maybe it's not possible for me. Maybe let that other persons do it, but we can do it. So we need to promote that women have this self-confidence in order to do projects, research, or any other activity that they want to do. Some advice based on the experience I have during my career, but also I'm still learning. Maybe in another talk or another opportunity, I can give you more. Career path change, so we need to be prepared. The best example was this COVID-19 pandemic, so everybody had to change because it was something unexpected, but we had to take decisions and be flexible with what appears on the way. We need to reorganize and adapt ourselves to the new circumstance. I had to adapt myself when I take the decision to come back to be a postdoc, and then when I decide to be chief of department, and then when I decide to resign that. So it's just a matter of adapt ourselves, embrace new challenge, be authentic and brave. Sometimes we need to say things out loud and stand for it. Even if that makes you unpopular, you have to say that. If not, things are not going to change. I learned that. So if there is something that I don't like, I express, my what I'm feeling about that. If people doesn't like and doesn't answer my message, but at least I said, look for a trusted team. For me, for example, what we are doing, all the things that we achieve, all the publication, the thesis, the recognition that we have at national and international level, is because we have a very good, trusted team and our collaborators and friends. And also give back, be a mentor. We need a next generation of scientists. I'm a mentor now of several students that are doing a PhD abroad. Others are independent researchers now, having their own lab, their own groups. And I'm happy for them. I'm happy if they are better than me, for example. This will be my best prize. Thank you very much.
Thanks, Dionicia, for your wonderful presentation, letting us know your excellent academic career and trajectory. It's now time for a question and answers. I have one question already, but at the same time, we can also welcome questions in a live manner. You can raise your hand and then ask your preferred questions, dear participants. In the meantime, I just forward the question I have to you, Dionicia. So the question is, you mentioned that leishmania research at the university did not involve that much field work. Does that mean there are no field projects in leishmania at the Humboldt Research Institute?
No, I mean that my PhD thesis was basically working with DNA or RNA in the lab. We have a research group that is led by Dr. Alejandro Llanos at the Institute von Humboldt, where they do a lot of field work, clinical trials. So it's different. I was working with Jorge Arevalo, that is mainly basic research, but there is another group that is doing apply and field for research in leishmania. For a long time, even this collaboration between ITM Belgium and the Institute von Humboldt started with leishmania, in fact.
Yeah, thank you for the clarification. In your presentation, I saw that like gender stereotype is one of the challenges in promoting women's and girls' participation in science, technology, engineering, and mathematics, which is often pronounced or abbreviated as STEM. So I think gender stereotype starts at very early in education, often at primary schools. So in that aspect, what do you think should be done to mitigate stereotypes early in education?
Maybe we can start at the schools, for example, trying to talk to the girls at the school that you can do whatever you want to do. If you want to go to space and be an astronaut, you can do it. And of course, we need to also to ask the parents to encourage their children when they decide or when they say, I want to be an astronaut, I want to be a scientist, I want to be a mathematician. So just encourage them to pursue what they want, not just say, no, this is not a career that is for you. You need a career that is more popular or is more appropriate for you. Yeah. So just encourage your children and at home when they say something about what they want to do. At the schools also, we promote these roles of women scientists, engineers. So the girls at school, they can see that you can be a scientist and live doing science.
Yeah, thank you very much. Another question for you is, do you have any tips for individuals who are interested to have their postgraduate education abroad internationally? Any advices or tips?
Yeah, well, in my case, I was at the beginning, I was thinking doing a PhD in the United States because it's more close for us and it was very popular at that moment. So when this opportunity with the Belgian cooperation appears and I discussed with my mentor at that moment about the project, about opportunities, and they say, okay, think about that and then give me your answer. So of course, it's new country, new customs, new people. In my case, it was something completely different from I was used to do in the lab when I was at the university. So it's just embrace the challenge. I mean, it sometimes could be difficult. I mean, it's not easy to live abroad and sometimes without family, but on the way you make the friends that became your family. No, so it's just a matter to face the challenge and be brave.
Thank you. I am kind of trying to mix the questions so that we will not have similar questions in a row. What are your advices to women who are starting on STEM or like science, technology, engineering, and mathematics?
One important thing that for me works is to have a very good mentors that, as I mentioned before, they encourage me to apply for projects, for example, to go to Congress, and they put me in contact with their own networks. So if you want to do STEM and you know a person that is working in the area that you know or somebody know, try to contact them and write directly to them. If, for example, there is a subject that you are interested to work with, or just write, because sometimes people say, I'm afraid to write because maybe they didn't answer. So the worst thing that could happen is that they didn't answer, but maybe they will answer your mail or your call, and they can give you advice how to do this career. I mean, for example, for me was nobody showed me the way, but what I'm doing now with my students is try to show the way and try to make not easy, because nothing is easy in life, but at least give some advice based on the experience I have or the experience that other colleagues have. So in that way, they avoid to make the same mistakes. No? So that, for example, is one thing, that look for a mentor, look for a person that works in the area and ask for advice, and just get contacts, and that helps a lot.
Thank you. Thank you very much. Let me jump to the next question. Thank you for your nice presentation. I wonder how many female professors are there in your department?
In my department, the good thing is that it's more or less 50-50.
50-50, okay.
It's not a problem of gender in that area.
Yeah.
But we need more young professors. That's male or female, we need to renovate the professors in our department and at the university in general, because we have senior professor, we have middle professor, like early career, but we need younger, because, for example, I already a full professor. I consider myself a senior. So it means that we need a new generation of scientists to come and take the work and continue. So I think we need more young professors to be incorporated at the university in the different faculties, in the areas that the university or the department decide they want to pursue.
Thank you. Let me also take this opportunity to ask you a follow-up question, my own question. In your presentation, you said that the participation of women in STEM is suboptimal. It's a kind of 32%, but most often concentrated in Lima. And as you have also said, you have women and men at parity at your own department. But in terms of the heart of science, which is translating knowledge into practice, knowledge from the field, the laboratory, into policies or guidelines, which could be used to improve the lives of people. How do you see women's capacity in the support or empowerment that they receive in terms of translating the knowledge that generate into evidence or action?
In fact, we are doing that as malaria group. As I mentioned before, we work very close with the Regional Direction of Health in Loreto and with the Minister of Health. Every time that they ask for an advice and a support, for example, to incorporate some information in the guidelines for diagnostics, for treatment, or if they want some support in some area that they need more data, more information to take decisions, we help with that. I mean, for example, in our work that we developed, for example, a new diagnostic tool for LAM. Now, the National Malaria Elimination Plan incorporates LAM as a new surveillance tool in the areas where there is a lot of suspecting malaria infections. This is, for example, how we translate the knowledge to them. And now the other thing is that, for example, the active case detection, or we are now validating, for example, a new RDT in San Lorenzo, in very far area in Loreto. This new RDT, if we found that it's better than the current RDT, this RDT could be used again by the Minister of Health with the promoters in order to go to this area where there is no microscopy available. So there is also a translational research that women can do. It's just, once again, a matter of communication with the authorities. It's not just doing your science in your lab to publish and to be very popular on the social network. It's also a matter of taking your science to the authorities in order to them to use this information. And also in the meeting that we have with them, we ask, what else do you need? No? What area do you think is important that we include in our projects? In that way, when we do this research, we back to them and give the information that they need. So this is possible, and we are doing that.
Okay, thank you very much. Another question, as you have presented, your research focus shifted from leishmania to malaria. What informed that change? How do you know when to change to another research field?
In fact, because of my mentors, when I was writing my thesis to defend, my mentor said, okay, you are now about to defend your thesis, so you need to look for your own niche. Because you see, there is people already working in leishmania, the institute, and they will continue. You can continue doing that, or you can look for your own niche. I mean, and for me, it was good because it was not easy, because, okay, at that moment at the institute, there were some researchers that were doing malaria, but very independent way. And in this, with this Belgian cooperation project, I had the opportunity to do a malaria research in an institutional way. So I had to talk with all the people that was working malaria at that moment, and say, okay, what are the gaps that we need to address? And based on this gap, we wrote the proposal and applied, and I became the leader of this component because it was part of what the Belgian cooperation was looking for. You have a PhD, now you move this PhD to a postdoc, so take this postdoc and give a new responsibility. That's what happened to me.
Thank you very much. Another question. Much as career paths change and hence call for flexibility, how would you advise a girl child in a resource-limited setting whose career path may be dictated by financial constraints to keep focused amidst that obstacle?
Yes, this is a very good question, because we have a lot of limitations for research. I mean, at least in Peru, we don't have a lot of budget to do research. We don't have a lot of scholarships for students to study at the university in STEM careers. It's difficult, and I see that, because when I go to the community and I saw a community of 200 people with only one school that opens from time to time, not all the time. So how this group of children then can move to secondary school and then to the university if there is no opportunities. In the last year, the government implemented these scholarships. There is one that is called Beca 18. It's a scholarship 18 for people that with very low resources. So they apply and they can get this scholarship to do a career at the university. And then what happened with them? They finish. They can look for a job, or we can promote them to move to the next step, doing a master or a PhD, for example. So once again, we have in the Faculty of Science, we have these two researchers that implemented this scholarship that is called the Miyagoni Scholarship for Masters students that came from this Beca 18 program. So this scholarship support them to move and do a master program, for example. And then the Concitec and other programs, they have some scholarship for a PhD. There are few scholarships, still we need more. but at least there's some point to start. But yes, it's difficult. It's difficult if there is no resources and there is no support by the government to give these students the opportunity to move to the university and then to a postgraduate school and then become independent researcher.
Yeah, thank you. Maybe as a follow-up to this question, do you have any endeavors or activities where you have the opportunity for high school students to come and visit your laboratory and then exchange ideas so as to like motivate them?
When I receive some call from my friends that work in schools, for example, there was a friend that asked me, can you make a video and explain my students from 3rd grade how you became a scientist? So I do these videos and I send to them so they can show to the students. Or for example, with the book that the Concitec developed with these stories of women scientists that are also to promote STEM careers at schools. And also at the Faculty of Science, when they have this program that is called STEM, promoting STEM. So there are people that go to schools and do some basic experiments and show them that you can be a scientist and do this kind of experiments if you choose a career in science. Mm-hmm. So, and if sometimes I got an invitation to give a talk in a school or on an activity related to promote science, I do it. If I have time and I'm in Peru, I do it because I think it's the best way to promote science and it's the way I give back, to what I already received.
Yeah, thank you very much. I asked this question because I remember my high school years when a kind of like women, like many of like the girls choose to join the social sciences department and the men go to the natural sciences because women are afraid of physics particularly. Then what do you think should be kind of like the educational portfolio? For example, a student should not really miss STEM just for kind of being afraid of physics, and then they can still come and like enjoy other science fields like biology and chemistry. Then what do you think should be done in that aspect?
Yes, I think also I was afraid of physics, but I think that the professors at the schools or the scientists, we need to find a way to how to communicate in an easy way how to do a science and how to learn science. Mm-hmm. So in the schools, of course, if people say, okay, I'm not going to do a career in chemistry because maybe there is some basic course that it will be difficult, but maybe there will be a way to avoid this kind of desertion because of these difficult courses, because we have maybe people with a good potential for chemistry, but they're not good in physics, but it's very good in chemistry. So we need to support them and give them all the tools to lose this, to don't be afraid and to continue the career, even if they have to face these difficult courses. Mm-hmm. I had to face difficult courses. Organic chemistry for me was difficult, but I had to study. I had to join with friends to study together. I have to take additional lessons in order to pass this course because it was a basic course to become a biologist.
Yeah, thank you very much. In this next question, there are some very technical terms. My apologies in advance if I misspell or mispronounce it. Are you still working on HRP2 versus 3 gene deletions in equitos? How do you personally feel to be among the first scientists in the world to report those deletions, which have gained so much attention and interest today?
Thank you very much for this question. In fact, yes, I think maybe not many people in my university know that. Yes, we were the first to publish and to report the falciparum strain that lacked these genes. At that moment in 2010, when we published this study, it was happening only in Peru, and then we had some results of some data from Colombia and Brazil. But because falciparum was not very important in our malaria endemic areas, because we have mainly buybacks, okay, was a publication, was very good to know that there is this kind of parasites in the Amazon region. But then, yes, you're right. In the last 10 years, 5 years, there are more and more reports about parasites with this deletion in Africa. And it's very important, and it's a very big problem there, because in our case, if we don't have parasites, if we have parasite with this deletion, so instead of using RDTs, we can use microscopy, and it's not a problem. But in Africa, they only rely on RDTs, and if the RDTs doesn't work because the parasite doesn't express this protein, so there is a big problem. Now, there is even a group from WHO that is trying to make some guidelines to support the National Control Program how to face this problem. Because we report already that this deletion appears. I'm not working in surveillance, but now I'm working in more to try to understand where this it was originated. So I have this master student that mentioned that he's going to defend the thesis in the next month. We sequencing some parasites, and we compare the genomes of these parasites from different regions, from different types, in order to understand if there is an evolution of our selection based on of this deletion.
Yeah, thank you very much.
This is Zoom, and then the publication later on.
Okay, thank you very much. The next question, it is a kind, let me summarize it. One of the main challenges women experience in science is when they decide to become mothers. Most women drop their career because it is too difficult to maintain work-life balance. Do you consider that when a female scientist decides to become a mother, she needs special support from her work environment? Have you faced that situation in your institution, perhaps also in your own career?
No, I mean, in the institution there are nowadays, at least what I heard from the institutions I visit, that there are some support from the institution for scientists that want to become mother, and they have this period of time that they are not working. Yeah. But in addition to the institutional support, it's also important the family support, the partner support, because it's not only that because she's going to be a mother, she's the only one that needs to be taking care of the baby. It's also the partner that needs to help, to support, or, because they are a couple. They need to work together. And institutionally, yes, it's a problem, because if you, during this time, you don't perform your research, you don't have publication, then it could be a problem when you want to apply. But if the funding agencies, for example, also consider this period, leave period, so they don't need to count this absence of publication as a problem, because it's part of life. Yeah. And I think, yes, the institution needs also to be more involved in supporting women that want to become mother with the help, to don't lose the research or the groups. So there are a lot of alternatives.
Yeah, you're right. Perhaps also promoting mother-friendly organizations where they can go maybe downstairs and then nurse their kids. Yeah, there are things which could be done to really improve this, like from a low-cost intervention. Yeah. Thank you very much. Do we have any other question? Is there anyone who is interested to ask one last question to Dionicia before I hand over the session to Charlotte? Okay. Yeah. Thanks for the presentation, Dionicia. Then I hand over to Charlotte.
Yes, it's also up to me now to say a big thank you to Dionicia for sharing your personal and professional career path, and for sharing your own experience, which means a lot to us, for sharing this with with our staff, alumni, and also students. So thank you very much for this. Also, Anthony, thank you very much for moderating the webinar. Also to the participants, thank you very much. There is also the poll, so please, thank you for completing the polling. And I will also take this opportunity to already announce our next upcoming webinar, which will take place on the 7th of March with ITM alumna Severin and colleague as well, Severin Kaluarts, who will share insights on the situation of sexual and reproductive health in Afghanistan. She will share her experience of working in a maternity hospital in Khost. So save the date, 7th of March from 3 till 4 in the afternoon. Thank you very much, Dionicia, once more, muchas gracias. And also to Anthony, and looking forward to seeing everybody back on the 7th of March.
Thank you.
Thank you. Thank you.